Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this broadcast series, we talk once a week about all types of globally relevant infectious diseases. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt, and good morning to everyone who is watching, or good afternoon, or good evening, depending on where you are.
Also, a very warm welcome to our monkeypox expert. You know him already from our monkeypox special. He's here today to address specific questions on monkeypox. Good morning, Dr. Lienert.
Good morning, Professor Schmidt. Good morning, Dr. Sanicas. Thank you for having me again.
Wonderful. And these are the topics for today. We will give you the global COVID-19 update. We will talk about ineffective COVID-19 therapies, about global warming, and then we have the monkeypox update and questions and answers. Let's start with Melvin and COVID-19. What happened last week, Melvin?
So, like what we do every week, we start with a quick global COVID epidemiology update, and we get this from the WHO COVID situation report. And this, of course, is not real time. So, this is a week late, but globally, the new weekly cases decreased by 24% as compared to the previous week. But it's important to keep in mind that up to 50% of people do not have symptoms, and these people are not tested and they're not counted, right? And the number of new weekly deaths decreased by 6% as compared to the previous week, with over 15,000 deaths reported. That's still a lot of people dying every day. That's around 2,000 deaths a day globally. But if you compare that to 2020, we were seeing then around 2,000 deaths per day just in Italy or in Spain, right? So keeping things in perspective, we can say that we are in a much better situation now, but things can definitely be improved further. Deaths and hospitalizations are still largely from the unvaccinated.
We have now end August. With September, temperature will go down. And what is your expectation, Melvin?
Well, since 2020, people have been saying that it will be worse during the winter because flu and RSV and other viruses are there, right? So we'll see. It's always hard to predict the future.
Thank you, Melvin. This is something I found in an article from the New England Journal of Medicine. There was a very strong article and also a commentary on ineffective COVID-19 treatments, telling people stop using these for treating COVID. And that includes metformin, ivermectin, and fluvoxamine. And what you see here for these three substances, very similar charts over time from day zero when you start the treatment to day 14 when you finish a treatment or when you finish following up the patients. You see the black line, that is those who received the respective drug, and in brown, those who did not receive the drug. And the scale on the left side, the Y scale, that is the severity score. It is a score comprised of different items there. And what you see, the treated and the untreated over time, they overlap. So most people, I guess, they get less and less symptoms over time in the treatment group like in the untreated group. So these treatments do not work, so don't use them. I think this is good news, right? We have some treatments available now. We have monoclonals, we have drugs, but these drugs don't work. That's the short message. Melvin, you agree?
Yes, and I think we have been spending so much time and effort and resources to study all these different drugs that we think or we want to work, but they're not working.
They're not working. Yeah. Let's go to something else. This is global warming, but this looks so confusing, Melvin. What does this mean?
So this is basically just from a recent study published in Nature. Researchers from the University of Hawaii traced pathways from various climate disasters to known outbreaks of diseases like cholera, like malaria. And they found that 218 out of 375 known human infectious diseases, so that is around 58%, they have been worsened by heat waves, by flooding, by drought, and by other hazards stemming from climate change.
So climate change has an impact on infectious diseases. That's the message here, what you
Yes,
see?
that is the message basically.
So precipitation leads to waterborne infections, and they are listed here. This is the short way to go this. We will have this in our show notes, so you can download it, and you can also download the article, the references down here. Very interesting. And Melvin, you have news from 1912
Yes.
as well.
And this is related to the previous slide about climate change, right? But this is from 1912. And basically, it's just saying that we are burning around 2 billion tons of coal a year. So bear in mind, this is 1912, right? And then you will see this graph about the CO2 emission from 1750 to 2020. You will see that it's just really going up, right? And we can correlate this with the study that I've showed earlier from Nature, basically showing us that all these diseases that we are seeing most of them are related to climate change. And climate change is then related to this CO2 emission that we are just seeing increasing and increasing every year.
Yeah. Actually, the correlation is quite clear, right? You have the increase in CO2 and you have the increase in global warming. I guess you could overlay the two and you would see that there is a strong correlation. In any event, this is quite impressive. And the one thought I had looking at this line here, I did a search for the number of humans on Earth. 2,000 years ago, there were 200 million humans on Earth. Today, we are approaching 8 billion.
8 billion. Yeah.
And the curve is really similar. It is really going up exponentially. In the end, there are too many humans on the globe, but it may not be politically correct to say this, and I don't know what to do about it. But it is too many of us burning too much charcoal or producing too much CO2. Very interesting. Thank you, Melvin, for this interesting insight. And I come to our next topic. What you see here is monkeypox reports from around the globe. And the blue dots, this is endemic areas where monkeypox cases have arisen in the past. And what you see now is these big brownish dots around the globe, and the size of the dot correlates with the number of cases reported from these areas. So there's a real big increase. And I was looking a little bit around for case series and a little bit on what is the clinical picture and what is the data we have there. And just last week, there was an article in the New England Journal of Medicine. They collected from around the globe 528 cases. You will download this in detail later on if you have a little bit time. Most of the cases are male. Most of them, 96%, were men having sex with men. 41% were HIV positive. And I think the important thing is that the median number of sex partners in the previous 3 months was 5, with a range from 3 to 15. And that explains why we see this outbreak, this current outbreak here. The reported history of smallpox vaccination during childhood was 9%, which is an interesting number, but we don't have a control group, so we cannot really say what this 9% means. But we'll hear more about that in a minute, because we have here our expert. Florian, this is your call. The questions that we received on monkeypox is, number one, is monkeypox fatal?
Yeah, thank you for the question. Monkeypox can be fatal. It depends a bit on the virus clade, and these clades have recently received a new nomenclature by WHO. So for clade 1, which is the clade that is endemic in Central African countries, case fatality rate has been reported to be quite high, around 10–11%. For clade 2A, that's the virus clade that is endemic in Western African countries, case fatality rate is lower. Historically, it has been around 3 to 4% or less. And the virus clade that is now circulating in non-endemic countries, which is called 2B, seems to have a very low case fatality rate. So as of August 19th, we have seen more than 40,000 monkeypox cases worldwide, and there have been less than 10 deaths reported in non-endemic countries.
So the short answer is yes, but current mortality in Western countries or from the current epidemic clade has a low case fatality rate. Okay.
Correct.
Short answer. Very good. Now, what is the long answer? What now after declaration of a pandemic health emergency of international concern? What will happen in the next few months?
Well, I think this declaration by WHO has led to more awareness about monkeypox, also more investments in countermeasures, and I hope it will also lead to more investments in research on monkeypox. There's still so many unknowns, especially also about the epidemiology in the endemic countries, in African countries.
So, will cases go up or will they go down? I would predict they will go up, but what is your view?
I think in the short to midterm, they will still go up in many countries. We have heard from a few countries where they're observing a plateau. I think cases will go up until we see a certain level of immunity in the very high risk population. So the MSM population with a high number of sexual contacts. And that immunity can either come through vaccination or by natural infection. And then once we have this immunity, I expect cases to go down. In the non-endemic countries, I think, in the endemic countries, it's a zoonotic disease, so it will not be possible to eradicate monkeypox.
Is there any plan for mass vaccination in endemic areas?
No, I think at the moment there's still so many unknowns in the endemic countries about the animal reservoirs, really the transmission, the proportion of human-to-human transmission versus zoonotic transmission, who the risk groups are. I think for that it's too early.
Okay, thank you very much. Will monkeypox be declared a pandemic by WHO?
And as Melvin said, the future is difficult to predict.
Melvin, what is your view? Will they call it a pandemic at some point?
Well, it's like the topic of COVID 2 years ago, right? I mean, people were saying that it should be declared a pandemic, but then the WHO is saying that actually the PHEIC is the highest level of declaration that they can do, and pandemic is not really in the treaty. So I don't know. I mean, they can declare it a pandemic, but I think it's already like a pandemic now. So
Yeah.
I don't know what it will change if they do that. I'm not sure.
I guess the answer could be factually, it is a pandemic already. To declare it a pandemic has political and financial implications for countries to do certain things or whatever. So this is not a scientific question, it is a political question. And
Yes.
we are the scientists.
Yep.
Florian, if you had smallpox vaccine as a child, are you immune to monkeypox? I just showed you 9% in this case series from the New England Journal of Medicine. They had received the vaccine. What is your interpretation of the data? I mean, you have more data than just this case series.
Well, so in the clinical trials where we have studied the monkeypox vaccine, MVA-BN, we have also in some of the trials included persons who have been vaccinated against smallpox in childhood. And in these subjects, we have seen a certain level of neutralizing antibodies against vaccinia virus. So you probably still have some level of immune response, but coming back to the case series, you have shown it seems to not offer full protection from disease. So there have been persons with monkeypox who have been vaccinated against smallpox in the past. And accordingly, in many countries, pre-exposure prophylaxis for monkeypox in high-risk groups is also recommended for persons who have been vaccinated against smallpox in childhood.
Interesting, yeah. Is there monkeypox transmission from pets to humans to pets? So is there a circular transmission?
I mean, this is not yet happening in the endemic countries. Of course, there's a lot of zoonotic transmission. Now, in the non-endemic countries, there have been first reports of persons infecting their pets. For example, there has been a report of a couple, two men who have been contracting monkeypox, have been sharing their bed, so have been in very close contact with their dog, and their infection, so by transmission from humans to the dog, has occurred. How frequent this is happening, I think we don't know, but I think it also shows again the potential risk of reverse zoonosis, so that we would see an infection of animals in non-endemic countries, and then of course that will change the epidemiology of disease fundamentally. I hope this will not happen.
I think it can happen in principle, but it probably doesn't play a big epidemiological role. It will not be the normal route of infection. It will be an exception. That would be my expectation, but I may be wrong.
Well, I mean, I've seen a recent publication where they have come up with an estimate of in which countries and which animals could potentially become infected with monkeypox, and then which could lead to sustained transmission in animal reservoirs. So similar to what we are observing in the endemic countries. And I think that the theoretical risk is there also in the high income countries. But yeah, indeed, let's hope it won't happen.
Yeah, interesting aspects here. Does the monkeypox vaccine confer a lifelong immunity?
We don't know. For the available monkeypox vaccine, MVA-BN, the licensure was granted based on animal data and on immunogenicity data. So at the moment, we don't have any effectiveness or efficacy data. From a phase 2 immunogenicity study, we know that a 2-year booster, so 2 years after primarization, 1 dose of this vaccine led to a strong anamnestic response. But for how long it confers protection, we don't know yet.
I have known Bavarian Nordic, your company, for decades, and you were always known for owning the monkeypox vaccine. Why? I mean, it was never a business, right? You had the vaccine, but nobody wanted it. Is there any plans for mass vaccination in Africa, in endemic areas? Is there any plan, this is interesting, a company not selling much of a vaccine or not making a big business, but having a product.
Well, that might be true for monkeypox, but the vaccine has actually been developed as a vaccine for prevention of smallpox. And the funding mostly came from the US government, who has a big stockpile of smallpox vaccines. So they have supported our company in developing a smallpox vaccine with a better safety profile than the traditional replicating smallpox vaccine. And the US and also some governments have been stockpiling this vaccine for prevention of a smallpox outbreak, being it accidentally or intentionally, so related to the risk from bio-terror attacks.
Okay. So that was the cause why you had this all along, but there was never much noise around it. Let me put it this way. Yeah.
Yeah. I mean, for monkeypox, we have provided the vaccine to the UK in 2 instances where there was monkeypox being imported from Nigeria, once in 2018 and then again 21. But these were small outbreaks, basically one or two cases in the UK.
Mm. The next question is, does getting sick with monkeypox give you lifelong immunity?
We don't know. Immunity after smallpox has usually been lifelong, so I think it's fair to assume that the same is true for monkeypox, but we simply don't know yet.
Yeah, the lesions that I saw are on the skin. They're either pustular lesions, vesicular lesions, or erosions. So this looks quite superficial to me, and I'm wondering if there is any very much of immunity, right? This is my question.
Well, I mean, these pustules and vesicles, they're very similar to what has been observed for smallpox. And for smallpox, in most of the cases, if you had the disease, you were protected for the rest of your life. So as I said, I think for monkeypox, the same might be true.
I think we have to repeat this in 6 months, and then we know the answers. Finally, there is treatment, tecovirimat. Is this working in monkeypox? Is there any data?
Well, the licensure of this antiviral was based on animal data, and efficacy and effectiveness data is now being generated in response to the outbreak. So again, in a few weeks or months from now, we will know for sure how well this antiviral works.
Melvin, any questions from your side to Dr. Lienert? Any urgent questions or unclarities?
So just curious whether there are other currently approved drugs that are being studied as treatment for monkeypox, just like ivermectin, just like all these fluvoxamine and other drugs that have been used for COVID. Are there something similar?
I mean, besides tecovirimat, there are a few additional ones, brincidofovir, for example. And I think that there have been tests with other antivirals, I think mostly so far in vitro experiments. So I think this is being looked at.
Okay.
This brings us to what we talked about today. Cases and deaths continue to decline. We don't know what will happen in the future. There are ineffective COVID-19 treatments, don't use them. Melvin showed you something on global warming and the increase of infectious diseases. It's really relevant. We presented a case series on monkeypox, where you saw the main ways of transmission and risk groups. And then we had a very long session, questions and answers, that answered all my questions on monkeypox that I had. Thank you very much, Dr. Lienert. This was really great to have an expert on this. It is really fun. Thank you very much for joining us today.
Thank you for having me. And
I finish up with our cartoon of the week, and it is, I'm sorry to say this word, bullshit, BS. So what is this? The bullshit asymmetry principle.
So this is Brandolini's law, also known as the bullshit asymmetry principle. It was named after the man who coined the phrase, Alberto Brandolini, and basically it just tells us that the amount of effort it takes to make up something, it's so much less than the effort it takes to corroborate the claims, to fact check, or to debunk whatever has been mentioned. It really just shows us that it's very difficult to debunk false and misleading information, especially online. And I think I have been doing this for a while now, and I definitely agree to this. Anyone can just basically say something or imagine something without logic or reasoning or facts. And people debunking are supposed to say why it's not true using facts and logic and reasoning. So it's just crazy.
Yeah. So it takes up 1 minute to say the moon is made out of cheese, but it takes hours, days, months, and years to prove that this is not the case. And I guess the fact check, the simple fact check would be, is this really logical? Is there any plausibility, or why is this bullshit? I think sometimes it's so clear that it's wrong that you don't need much. But if you really want to be a scientist here, look, this guy comes up with the idea of spectrographic analysis and I don't know what. It takes forever and a lot of money and effort to rule out that the moon is made of cheese, right? Very interesting. Thank you, Melvin. And this was our Global Healthcast on August 23rd, 2022. Please like, share, and leave your comments below. Thanks for joining us today. Thanks, Dr. Lienert. Thanks, Melvin. I am Joe Schmitt.
And I'm Melvin Sanicas. Thank you very much, everyone.
And thank you again, Florian Lienert. Thank you for being with us. Bye-bye.